Good morning. Welcome to my reflection and synthesis of what I've learned in Nursing 685, Theoretical Approaches to Evidence-Based Practice. My name is Erin Congleton. I'm a student at the University of North Carolina, Wilmington School of Nursing, and my instructor is Dr. Barbara Lutz. I hope you enjoy my presentation. Learning about nursing theory this semester has changed my personal perspective regarding nursing theory. Before taking this course, I knew very little about nursing theory. After this course, though, I have learned a great deal about theory and how nursing theory is fundamental to nursing practice. Nursing theories are a critical element to have in one's arsenal when they plan to practice as a DNP. Because clinical roles of DNPs are so vast and impact so many areas in nursing care, we must understand how the theorists have paved the way for us. They have used something like blueprints to help us provide better outcomes to patients in medical settings. These theorists assure that the care is provided using the best evidence-based practice. What is important to remember is that these nursing theorists have come before us to set the pace and show us that we need to pick up the torch and carry our profession into ever-changing waters known as healthcare. I know this to be true after reading about different theories this semester. These theorists practice in settings that are probably familiar with other nurses in similar roles as we have now. These theorists have planned their approaches to continually be revised and edited by nurses that follow in their footsteps. In this way, these theories are dynamically designed. I love that part that I realized after reviewing the different models of mid-range theories that we reviewed this semester. This semester has clarified the role of a doctor of nursing practice for me. Even though I had started reading about the differences between nurse practitioners and DNPs way back when I started thinking about what my next step should be after finishing my BSN, I have learned so much more about the DNP's role this semester. After this course on theoretical approaches to evidence-based practice, I have learned much more about the doctorally trained nurse practitioner's requirements and why there is so much education required for this critical clinical role. With that said, nursing theory is the backbone of evidence-based practice. It is with nursing theory and nursing science and practice that these skills are vital. With the knowledge gleaned from nursing theory, especially middle range theories, we can have a framework to guide in planning and implementing evidence-based changes in practice settings. Early in this semester, we interviewed with a doctor of nursing practice. This interview was an eye-opening event for me regarding how much I can contribute to the area of nursing. The DNP that I interviewed stated that her personal life and professional life grew exponentially after obtaining her DNP. Presently, she is actively involved in changing her community's environments, the setting in her hospital setting, as well as nationally and globally. With the education that she has received in the DNP program, she stated that she feels that her viewpoints have much more weight when being considered in changes of how care is provided. The levels of nursing theory and the nursing meta paradigm have probably been the most crucial information learned this semester that I can use in my practice setting. Before this course, I did not even remember hearing about a nursing meta paradigm. While using this graph here, I have been able to thoughtfully think about and plan how I would like to address issues and problems that I may identify in my practice setting. I also believe that this theory could be used in any setting for that matter, not just in medical settings. When looking at this graphic, I am reminded that there are ways that change can be addressed and implemented and that can be done in a systematic method. Using all the levels or just some of the nursing theory levels from most abstract to concrete can lead you to make some essential practice changes or personal changes. Even better, You can use all the nursing theory levels from most abstract to most concrete to follow through and translate changes that need to be implemented. Philosophies and theories are different, but so are the situations that nurses are faced with daily. Suppose we become more familiar with the philosophies and the theories that are out there. In that case, we can even use ideas gleaned from one theorist to tweak problems identified that do not fit into any one theorist's philosophy. All levels of nursing theory can provide the best outcomes for patients in care settings. As nurses, we have to remember that when we identify, implement, and then translate the critical information gathered, we then affect the patients in global settings from the information that is published or translated. For me, the most impactful knowledge learned this semester is the feeling of empowerment that I have been given to impact changes in healthcare settings. When deciding on which way to continue my education, as I've stated earlier, my choices were between nurse practitioner and the DNP. During this semester, I believe I have realized that I have made the correct choice because I wanted to impact change in an oncology setting. Both my husband and my brother have had to deal with cancer, and one of the fastest areas of research and growth, except for COVID-19 at this point, has been cancer treatments and cancer protocols. As a nurse, I know that there is still a lot to accomplish regarding treatment and discussions of comfort care and end-of-life care. One essential item that I have learned since becoming a nurse, and not just a family member of someone with cancer, is that there are things worse than death. It's a sad fact to know, but a very relevant point to know when caring for cancer patients and their families. The items that have impacted my skills level and proficiency are learning that there have been people who come before us as nurses and set guidelines to help us implement change. It wasn't until I started applying nursing theory to my PICO question from the Nursing 686 course that I could see how valuable of a tool this is to nurses. This tool is vital to implement changes in practice settings and nationally and globally as well. There have been many surprises learned this semester. As a second-generation nurse, I was surprised to learn that nursing theories are relatively recent and that many theorists are alive and well. In fact, Dr. Malaise, who I have researched this semester, is still active in nursing and healthcare. I have also learned that the DNP role is a relatively new role, but one that is vital in medical settings, especially after reviewing the 8 essential elements of the DNP program as discussed by the American Association of Colleges of Nursing, or AACN, and read about during the semester. I loved how the AACN laid out such a detailed roadmap for DNPs to know the knowledge needed to fulfill their roles. This document details the crucial role that DNPs play in using the knowledge learned in the DNP program to aid hospitals and medical settings in advancing clinical practice guidelines, reviewing and translating evidence-based projects. These are crucial areas that clinical doctors of nursing practice can prove invaluable for in any medical setting. Another one of the essentials, Essential 3, discusses how these clinical practitioners are imperative in working with physicians, clinicians, and interdisciplinary members of treatment teams to scrutinize current practices or practice settings and appraising the need for areas in quality improvement, patient well-being and protection, and the protection of employees while working in medical settings that DNPs are employed. Even though I'm a new DNP student, I believe I've gained quite a bit of confidence in my ability to use LEVEL as a foundation for building evidence-based practice projects and to bring about positive changes in clinical practice settings. As a DNP, I do believe that I will learn what is needed to be able to think about the theoretical framework, the problems or needs in a situation, develop a question, use those questions and findings to design a methodology, use a nursing theory, find out what implications they are, and provide recommendations, which is important for being a DNP. Here are my references for your review.